Forget about same day trips. You take on same hour trips.
That's what a lot of my facilities love. They call me last minute. I can make it happen.
Welcome back to NEMT Experts. I've got Hossein Mokhtari with me, the owner and founder of Essential Health Transport in Los Angeles, which you run with your wife. Hossein, how you doing?
Wonderful. How are you?
Give me the background of how you started Essential Health Transport.
I'll give you the QuickBooks version. We started during the pandemic time. My wife / partner, she worked about 11 years in case management at different hospitals. I spent my time in the automotive industry being a fixed ops director. During that time, variable reasons, we looked into this area of opportunity. We looked into this industry, and we took a leap of faith, and we really didn't know much about it when we got into it, but 2 + 2 = 4. So we plugged away one by one, and we got here 5 years later. We're still running.
Born out of COVID, out of the need for essential health services, you created Essential Health Transport.
It was a unique time. And yeah, we had family members who were struggling with transportation. So a light bulb kind of went off in our head. Maybe there's a need. We need more providers in this area. And that's where Essential Health got created. Yeah, the COVID baby.
COVID baby. Tell me about the first steps this COVID baby took. Tell me about the first trips you did, who you did them for, the inception of the business.
Well, yeah, it's an interesting path when you start your own business. First, it was just about kind of building a van, getting our company out there. At first, it was my wife and I with one other employee rendering the services. I still remember our first ever patient that my wife and I had to render services for. Every patient has a story to tell, and everyone's experience, but it was interesting. And, we made a long-time patient out of her with our first ever patient. So right then and there, we realized, I think customer service, quality of care, and that human element goes a long way. And there was an opportunity to do things a little bit differently, really emphasizing on the patient, customer care. We came from the background of customer service and case management. So customer satisfaction is our utmost priority. So we kind of based our model around that. How do we provide the most professional and friendly service in town? So from our vans to our uniforms to our team members that we've evolved to now, we kind of kept the same culture and mold, which is take pride in what you do, take care of your patients, do it with integrity, do it with honesty, and do the best you can, and treat them like family. That's really been our motto. Every patient, quite frankly, feels like there's a family member caring for them. We really emphasize that as a company culture, and it's gone a long way for us.
That's a winning culture.
It is. Really, our model has been about a culture. And, when we looked at the field, we thought there was an opportunity to do things and create a new culture, between just appearance to professionalism to the rendering of services and the human compassion and just really being there for the members and the members' family, assisting them navigating through these unknown ways of how do you coordinate transportation, how do you get insurance qualified for it, kind of guiding them and being their own case manager and social workers in the process of being their transportation provider. We wear many hats.
I like that. More than just transport.
It has to be. Transportation is in essence taking an object or a human being, in this case, from point A to point B. But the mannerism and the way you do it makes a world of difference. We believe in treating every employee and every patient with a certain mindset. Our employees get respected and treated by a certain manner in the field because of how well they conduct themselves and the mannerism and the professionalism and the culture we built over the last 5 years. I hate to say it, but we're the men in black. Our uniforms are in black. When you see our vans roll up, they kind of know which company it is. We're very much in uniform, in alignment. All our vans are uniform. All our employees are uniform. And you really wouldn't get a different service depending on which team members I put out there or which van. It's the same experience every time.
And Hossein, I got to see that in person because we got to hang out in person at the NEMT conference the other month, and you brought one of your team members, Tariq, with you.
Absolutely.
And we got to see just how passionate Tariq is about the business, just like you are.
Yeah. He's been with me since we started the company. Pretty much one of our first onboard hires. Started off part-time, and he's grown his role, became a full-time employee. Now he's my business development manager and marketing manager. And I believe in, relationships are a big key to this. So between the patients, families, facilities, all our contracted partners, having a manager, having an entity that checks in with them, gauges, sees how we're doing on a daily, weekly basis, and really follows up on what their needs are, what their pain points are, how we could best relieve them, and having a liaison for the company that really represents the company well and is constantly out there visiting facilities, building that relationship further strengthens our success. And it's really gone a long way in building the report that we have. We predominantly service the LA DOT area and LA County area, but mainly emphasis on the San Fernando Valley. And I'm blessed to say everybody in the Valley knows us, and everybody's pretty much contracted or partnered with us at this point. And we're regular fixtures that we're there on a weekly basis, whether we're rendering service for a patient or just stopping by to visit.
I love that. Hossein, I want to talk through the journey over these past 5 years since you started the company. You started out, everybody starts out with one vehicle. You started doing trips for whoever it was. Tell me about the journey of how you've expanded the business, started working with multiple different kinds of payers, expanded across the San Fernando Valley and beyond, growing your team, growing different functions. Give me sort of the step-by-step, like year 0 to 1.
There's been a unique evolution. Obviously, everybody wants private pay patients, but how do you acquire them? You have to get out there. So we started working with numerous insurance brokers and providers, and we had great partnerships and relationships. Even though we only had 1 or 2 vessels at first, we still did as best as we could, taking on as many trips as a day. Really got ourselves acclimated with different providers and what their standards are, what their matrix are, and got to introduce ourselves to a lot of facilities through the path of going through insurance. We visited a lot of facilities and built a brand and relationship with them at that point, where now the facilities start calling us and requesting us from their insurance. And it kind of became a domino effect of that, where we started with 1 or 2 agencies, which were Wellride and Call the Car at the time of, and then we expanded to other providers, and we just started kind of seeing what was available in our areas, how we build a schedule, how we could kind of build our clientele base and our relationships. And the insurance was a big part of that. We did a lot of broker work at first, but now in years past, we have kind of transitioned to being more of a 50-50, where we're not purely doing insurance, where we are doing a mixture of, we have a series of private pay patients who have been with us for 3, 4, 5 years, believe it or not. Since day one, I have some patients that are still with us, which is a blessing, and on the road to better health and recovery. And, we still continue to have great relationships with Call the Car and other insurance providers and brokers. But we also are blessed that our phone rings a lot from our facilities and our patrons that want to book us exclusively for a wide array of things. It's not just medical appointments anymore. If they have a function, if they have an event, if they have an outing, at the end of the day, if they need to get from point A to point B, we're the first call. Morning, day, and night. Even I've taken some of our members to their daughter's weddings and helped them walk down the aisle. So, it's been a journey, to say the least. And
Tell me, Hossein, some stories along this journey, stories of how you were able to win facilities to get your private pay work or one-off private pay passengers, because, this is something that a lot of transport business struggle with as they grow. Like, hey, I want to be able to get in with facilities directly and get, what's the best ways to do it? And what are some of the learnings you've had in being able to do that?
For us, to be honest with you, it's about really building a relationship and introducing yourself to them and starting a report with them. What are their pain points? Each facility, each broker has certain pain points, certain challenges, whether it's trips at certain hours or certain levels of trips that they can render out. So we really got granular about those things and saw how we could best align in helping them with their pain points. And in doing so, we're able to build a strong relationship, because at the end of the day, if you're able to relieve somebody's challenges on a daily basis, whether that be timeliness of transport, whether that be some transport providers don't want to do bariatric patients, variety of variables that align, we try to see what their needs were, what their challenges were. And quite frankly, a lot of companies don't like to do bariatric patients, and we take pride in having the equipment and training to do so. A lot of members don't necessarily want to help with as many of the lower level patients, but our vans are outfitted for multi-loading of different levels of patients. So we're built to be able to accommodate most needs, if not all needs, on a day-to-day basis. Realistically, we do a wide range of bed-bound patients. The heaviest that we've done is roughly around 650. So we don't shy away from many challenges or opportunities to transport safely and professionally. But at the end of the day, we have stories to tell for days. One of our unique ones was relocating a member of ours to Colorado. So we've done long distance relocations. We've done obviously in-state relocations. We have a wide range of patients. Most of our patients are dialysis patients. So we see them 3-4 times a week, plus whatever excess things they need. So we've become a fixture with these facilities and members in the households, in essence, where we see them quite often.
You see, this is a consistent theme I hear among the savvier operators who are able to successfully grow their business. They get in with facilities by doing the kind of transports that nobody else wants to do.
Absolutely.
Whether it be 4 a.m. rides or a stretcher at this, odd time of day doing it, or in your case, handling bariatric passengers, which none of the other transport businesses in your area apparently wanted to do. You get in the door by doing the kinds of rides that nobody else wants to do. And that's how you build your repertoire.
I mean, everybody wants the gurney patients. Everybody wants those. I get it. Everybody wants the private pay patient, customer pay patients, but that's not reality. The reality is you have to find the right mixture, right ratio. And in doing so, I found that if you help others with their challenges, they will help you build your business, because transparently, they want to have more of my units out there to assist them. That is a common request. How can we help you grow your fleet more so you can be more available, have more vans available to us, and exclusively service us if possible? So that's the ultimate goal, is grow, but without losing the culture, which has been slow and steady is my model. And right now, we've been blessed that we've built a great rapport and relationship. We've proven that we could help them with the most challenging of patients, whether it's from the insurance that has a patient who's complained about every provider, or the facility who the patient never wants to go. We're pretty good at what we do, and we've overcome those challenges and hurdles where we've made it a normal patient and a normal experience for those parties, and their days go a lot smoother with our assistance.
Give me a sense of the makeup of the business right now in terms of numbers. Like, how many different facilities do you work with? How many trips do you do on a daily or a weekly basis? How many vehicles do you operate with? You said you do a lot of dialysis patients. Like, are you mostly doing wheelchairs, some on a stretcher? Just give us a sense of what the business sort of looks like on a day-to-day basis.
Yeah, we've scaled. We have about 7 vans and growing right now. And in doing so, we do a wide range of trips. All our vans are outfitted to do ambulatory, wheelchair, and gurney patients, and I can multi-load simultaneously. So our capacity and availability is pretty unique. And with that said, any given day, we start off as early as 2:30, 2 in the morning, and we go till the early evening time. So we run a pretty wide shift, and with our vans covering the general area of LADOT and the San Fernando Valley, on average, every van will do about 10 trips a day, something along those lines. We average, on some days we do more lower levels, so I could fit in a lot more of them. Some days it's a lot more gurney bound, but our mixture is pretty consistent right now, where we have probably about 70% of my schedule is pretty much fixed with regular patients, standing orders, things of that nature. And about 30% is the influx, which Run Bambi Run helps me run it very simply nowadays. But, it's just, we have a good mixture, and that's what it is. I don't do just gurneys, although I would love to. I don't, because my facilities, my contracts, my relationship need help with the lower level. So I do the best that I can to multi-load and assist as many of those members as I can. And some days I'll just dedicate a van to do wheelchairs, because some facilities just have an abundance of wheelchairs, and that's just really what the algorithm is. Really, at the end of the day, I try to have a good, healthy balance on a weekly basis, and we are able to manage that. And through Bambi, we monitor very carefully, and Tariq and Samson and my team in the office, they make sure that we have the right ratio every day, and we maximize what we could take in. And we're very good on taking same-day trips. A lot of companies don't take on same-day trips. I take on same-hour trips. If I can make sense of it, if I could squeeze in an extra trip and not be late to another one, why not? Let's get another member from point A to point B. And that's what a lot of my facilities love. They call me last minute. I can make it happen.
I love that. Forget about same-day trips. you take on same hour trips.
Being in the San Fernando Valley, I have dozens of facilities around me. And having said that, it is challenging working under the parameters of LADOT and being compliant with all those things. But if you do things right, there's a wide audience available to you. And we've won over many of them, to say the least. And having said that, they call me often for same-day trips, discharges, transfers, and we're happy to say yes early and often.
Hossein, tell me about your team. So like, in addition to running this business, you and your wife run it together. You also live a life. You have 2 young kids. You're going to soon have a 3rd kid. How have you built a team to help manage this business? What are the different team members? What do they do? Tell me about how that's evolved.
Transparently, my team's the reason for my success. I mean, anybody could put a van out there, get the right license credentials, and don't transport these patients. My team makes a difference. I mean, I'm proud of my team. I love my team. I've had my team growing for 5 years. There's about 15, 16 of us now. Many of them have evolved into greater roles. I have a fleet manager that's been with me since day one, pretty much. He actually came from Mercedes-Benz with me. And he runs my fleet and manages my fleet to make sure everything is roadworthy, stellar, not just aesthetic, but mechanically, functionality. So we never run into road problems as best as possible. I have a field training officer, which I'm blessed to have. Best guy I've ever met in the field, possibly. He came on board fresh out of EMT school. He's grown, evolved in our company. Now he's my field training officer, which allows me to have the uniformity that I do in the field, which everybody does things the same procedure, same structure. And we all constantly do training and refreshment training just to make sure everybody's very versed on what is the right process and protocol to transfer patients. But again, we do a variety of unique patient and challenging ones. So we have to have our procedures and instructions very uniform. So I can send any team for any transfer and not really bat an eye. I don't really have to really look at my team as if so-and-so could do this or that. They're all well-trained, from my EMTs to my drivers. They could all pretty much render any task I ask them to. And most of them wouldn't even know who's an EMT or driver by now, except for the uniform difference.
So you have EMTs on your team?
Absolutely, absolutely. Although it's not a requirement for LADOT and it was taken away, I think, in 2022, I believe in it. I believe it is the right level of service, especially when you're doing gurney, bariatric gurneys, certain challenging patients. So I'm proud to say that more or less half my team has always been EMTs. And it's going to continue to be so because I feel it is the right level of service we provided. And it's paid dividends for me to have those caliber individuals in the field. But again, my drivers do a stellar job. And if it wasn't for the EMT logo on their sleeve, you probably wouldn't know the difference.
You're making all this difficult stuff sound too easy.
Oh, no, I've had many great hairs, many sleepless nights. It's just, I'm finally at a point where I've survived some of the storms and battles, some of the challenges, and I'm in a place.
Tell me about some of the storms, some of the challenges, some of the things that gave you some gray hair.
Finding the right partnerships, finding the right contracts. Because although, optimism and hope is great, a lot of times when you get into a new contract or opportunity, you hope that things end up being fruitful for both parties. It's not always the case. So the hard education lesson was finding the right partners and relationships that align with our business model, which can actually help us grow rather than just, quite frankly, bleed out financially. So finding the right partnerships and relationships has been the biggest learning curve, from facilities to insurance brokers, because I've tried them all. There is an insurance broker agency that services California that I haven't worked with, and I've narrowed it down to a few. I've worked with every contracted facility in the Valley and in the LA County area, and I've narrowed it down to about 24. And those learning lessons, unpaid invoices, challenges of aligning with partnerships was probably my biggest lesson learned. Now we're at a place where I think our relationships are mutual. They are both prosperous for both parties, and we grow each other's opportunities rather than one person or one end always capitalizing while the other one is struggling.
Where the business is today, after you've grown it from COVID to today, right? You've, like you said, worked with every payer in your area, right? In California. where do you see the business in another 5 years from now? Like, do you want the business to largely look 5 years from now like it looks today, or what do you plan for?
Um, five-year business model. Scaling out into two other counties. I want to have a location in Ventura County and a location in Orange County. And so that is part of our expansion project for next year. But currently, I have a lot of time and energy spent on our BLS and ambulance operating license. We are looking to evolve beyond NEMT and evolve into the BLS and eventually ALS. And so looking at the higher levels of service, different levels of service that we could provide, expanding our availability for hospitals and things of that nature, and really becoming the go-to entity for non-emergency and emergency in this area is my next year plan. And the 5-year plan is to expand this model into two other counties, which would be Ventura County and Orange County. Currently, I'm at the final stages of crossing that finish line for BLS. So God willing, by this month or next month, I have my hearing with EMS. They give me a blessing and we start that venture early next year. But I still want to keep growing my NEMT business because I see the dividends it has, the impact it's created in my community, in my area. And I want to have probably about 3 different counties, 10 van fleet in each. And kind of that will be our immediate goal before we start looking out of state.
What are some of the biggest changes you made to the business in the past 1 year?
Empowering my team to take the steering wheel and for me to really work on growing the business than running the day-to-day business. Allowing my team to show me their abilities and entrusting them to learn, grow. We'll make some mistakes along the way. I still make them. So that's been the biggest evolution. This year, as I mentioned, Jose, Tariq, and Samson, they're my 3 musketeers, as I call them, and the 3 of them have had a huge impact on our business this year because they helped us streamline and really take over the day-to-day operations, whereas I don't have to run around and make sure my fleet is roadworthy every day or every week. I now have a guy every day. He makes sure he checks on my vans. I have an FTO, I have an operations manager and a dispatcher, and I have Bambi now. And Bambi's been the nice cultural change for us since summer. And it's really helped me streamline things, do things remotely more, not have to be at the office as much. And that's the challenge. How do you have yourself be in 2 places? I want to run the day-to-day operations, but I want to help grow my business. And you can't really do both at the same time. So you have to pick. And right now, I'm choosing to help my team grow our business while they run my business to the most degree. With obviously our support and certain tools like Bambi and other parameters, but it's working. That's been the biggest change of 2025 for us.
You were actually on vacation in Hawaii at the time that your company switched over to Bambi earlier this year. And while you were on vacation, this happened, and you still got to enjoy your vacation, as far as I know.
I have an annual family vacation, which I'm blessed. We planned it out. We take off about 2 weeks to Hawaii, and it was right around the same juncture that I was just at my wit's end with my other, I won't mention what company or program it was, but I was at my wit's end. I need to make a change. And that's when we're in conversation about onboarding. And by the time it all came down, it was right around my vacation time, 2 days prior. I had a meeting with my guys. I said, how do you guys feel about the demo? How do you guys feel about everything? They said, great. I said, should we wait till I come back, or do you guys want to launch it now? They looked at me with no hesitation. They said, go on your vacation. We'll launch it. So I saw Bambi for a day before I went on vacation. We onboarded, launched within like 24 to 48 hours. And I won't lie to you, my phone didn't go off a lot. You know, the guys figured it out. You guys were available in case you had any questions. The onboarding was seamless. The training was, I feel like, autonomous. It was just really you guys and your web videos. And they kind of got the grasp of it. And they really got familiar with Run Bambi Run by the time I got back. And by the time I got back, your system had already picked up our algorithm, was already kind of helping us coordinate our schedule, multi-load, and we're kind of just built on that. So their model is, if we didn't need you for those 2 weeks, you have now time to grow the business, get us more vans, and help us grow and let us do this. So We love Bambi. I mean, at the end of the day, I've said it to you before at conference. I've said it to everybody I've spoken with. I'm an advocate of programs that work. I'm an advocate of things that make managing easier and simplify rather than making it more complex. Some have tools that could be great, but after it takes months of retweaking and training and learning for you to maybe get the end result you desire. Bambi was like a flip of a switch. We turn it on, very similar to Outlook calendar, very easy for the eyes to digest and maneuver and navigate through things. And you guys' availability, every time we had any challenges, the few times we did was instantaneous. And I remember when we were at the conference, we were talking about multi-loading and certain triggers and certain things. And by the time I got home, you guys had a pilot ready for us to try out and play around with. So you and Charles and your team are phenomenal and really receiving our feedback and really trying to work with us and implement things that make the system work better for our industry. And it's been a blessing. I mean, it's been half a year now. It's been great. I look forward to it. And part of my next 5-year plan is going to be go Bambi and help me remote monitor different locations and facilities. It comes with great tools and operating systems. And I think I've now started to find it. I've tried many of them. I've tried Routini, WellRide, MediRoutes. I tried them. I tried and I tried and I tried. And I think I finally found something that would make sense for us in our company. I can't say for everybody, but I think most people in my industry, if they tried your software, they'd have similar end results. It's easy to use. And that's the biggest thing. And making changes, making adjustments, doing anything on the fly, recoordinating your schedule halfway through the day. I've had it happen. One of my bands went down. Somebody hit it. It happens. What do I have to do? Run Bambi run and rediscuss the rest of my day. We're making minor tweaks or adjustments if possible. And that's what it allows you to do. On the fly, it allows you to. It's also what allows me to take on same day, same hour trips. That I know exactly where my gaps and opportunities are. And if I want to take on an extra trip, I could always utilize Bambi's tools to maneuver some other trips around and still maximize our availability and maybe get an extra trip or two in. So those have been some of the great key points of it, but I think the best thing is how user-friendly it is. I haven't had a staff member that has struggled with the app or the web version of it, and that's a blessing. Anybody that have sit behind the app or the computer, they can kind of figure it out. So having said that, and I like the app. It allows me to remote look at things. Even if I'm at the kids' school at an event, I could look at things and see how they're going, see if we're on track. And the reporting tools are great. It's really helped my team realize what we need to do on a daily basis, where our opportunities are. Helps you really key in on what van is doing how much, which drivers are doing how many trips, how many miles we're driving. A lot of those analytics are now centralized where I don't have to put them together myself through different networks. So a lot of those tools, and I'm only curious to see what you and Charles and your great team are going to come up with, because I know you guys are always working on enhancements. We're not done yet. But so far, it's been good. And, looking forward to the next 5 years, looking forward to next year. I think next year is going to be a big one for us. And then we'll get to double-digit bands and have BLS next year. So it's going to be exciting.
Run, Bambi, run.
Run, Bambi, run, baby.